I am Sangeetha Madhavan. I'm a professor in the Department of Physical Therapy at the University of Illinois, Chicago. I also direct the Brain Plasticity Lab here. We know that traditional rehabilitation, it does not provide the necessary neuromodulator release. What do I mean by this? We do not tap into the brain in order to cause the changes that we need to see. Although stroke is a cerebrovascular accident and a disease, there's a lot of things happening in the brain which we do not address in traditional therapy. There is reduced inhibition on the affected side and an increased excitability on the unaffected side. Some of the things that we do with regards to neuromodulation is try to balance this excitation and inhibition that occurs in the brain. And the primary way we want to do this is we want to provide neuromodulation in combination with task-specific training in order to improve function. I almost think of this as a kind of like a caffeine boost to your brain so that your brain is ready and responsible for training before you start receiving therapy. So just a little basic science into how neuromodulation works. Basically, neuromodulation affects the physiological processes of the nervous system by altering the excitability and inhibition of neurons within the brain and along the corticospinal circuit. It can either directly influence the way the neurons generate action potentials, it can modulate specific circuits, and this targeted neuromodulation can shape synaptic connections, influence brain rhythms, and promote neuroplasticity. All of these are necessary for long-term changes in neural function. So broadly, neuromodulation can be classified into direct and indirect neuromodulation. Direct neuromodulation is techniques that can directly affect neural circuits. Some of the examples are non-invasive electrical or magnetic stimulation, like TMS, some of you might be familiar with the term, or transcranial magnetic stimulation, TDCS, which is transcranial direct current stimulation. Some of these techniques can also be invasive, like deep brain stimulation, vagal nerve stimulation, and brain-computer interfaces. Some of the indirect types of stimulations involve movement-based. For example, movement of the legs or hands can influence activity within the brain. You might have seen studies which show that aerobic exercise boosts brain plasticity. There's also a newer technique called remote ischemic conditioning. It's called blood flow restriction when it's used for athletes or individuals who have not had a stroke. And there's also sensory priming using either transcranial electrical nerve stimulation or other types of sensory techniques, which can change motor afferents within the brain.